Namaskar, Johar, and good evening to one and all. Myself, Dr. Suman Sinha, Chairperson Vaginal Surgeries Committee, Fogsi, and your host for today's podcast. It gives me immense pleasure to welcome our dear Foxians, revered dignitaries, and our esteemed viewers in the 270th episode of Gyan Pravah, a name that beautifully reflects our mission of continuous flow of knowledge. It is a celebration of shared knowledge and wisdom through thought provoking conversation and Foxy's unwavering dedication to academic excellence across borders and especially empowering mind and enriching women's health care. एक राष्ट्र एक मिशन स्वस्थ नारी समृद्ध वतन. It is also an incredible opportunity to welcome two iconic leaders, Dr. Sunita Tandulwadkar, President Fogsi, and Dr. Rajiv Rathi, Principal Director and Head Transradial Intervention Program, Department of Cardiology, Max Super Speciality Hospital, Saket, New Delhi. I'm truly blessed to share screen with them. And the theme of our today's podcast is Know Your Lipids, Essential or Dangerous, which is least talked about. But before we begin with the actual conversation, I would like to briefly introduce our two leaders to the viewers. So first of all, I go with Dr. Sunita Tandulwadkar, Madam.
Manji, everyone, every day I join. Please don't waste time on me. Sumanji, please, thank you. I feel very awkward when chairperson keep on introducing me. Thank you so much, dear. Thank you.
Madam, for your welcome address, Madam. Kindly welcome.
Yeah, Rajiv ji, thank you so much for joining on a Foxy platform. Foxy, our federation of 46,000 gynecologists, and I have 30 dedicated chairperson like Dr. Suman and 29 more. And 30 days, 30 chairperson, every day, 8 p.m., they have this podcast series. This I have given them as a gift so that they develop their leadership quality. They can have a freedom to decide whom they want to interact, whom they want to have an action and what topic they should be choose. All is their decision. As I just join every day to welcome the faculty, to show the respect, and they are giving their valuable time for Foxy. I'm sure at the end of 365 podcast, it will be a huge collection of knowledge from all the fields. Even Nitin Gadkari ji was there in our podcast series. So thank you so much. And Suman, you always bring out the best of the faculty. And I wish you both the most enjoyable moment and the evening of yours. Thank you. Thank you, dear.
Thank you.
Thank you. Thank you. Bye.
Thank you, Madam, for joining.
Thank you.
Bye. So now I take the opportunity to introduce our second leader, the guest faculty for today's podcast. He is none other than Dr. Professor Rajiv Rathi. He has a very illustrious academic background. He has done DM in cardiology from GSVM Medical College, Kanpur, and has over 25 years of experience in performing complex coronary angioplasties, including chronic total occlusion, bifurcation lesions, left main stenosis, and peripheral intervention. Currently, as said before, he is Principal Director and Head Transradial Intervention Program, Department of Cardiology, Max Super Speciality Hospital, Saket, New Delhi. He is a teacher, mentor, and guide to fellow interventional cardiologists for transradial intervention. He performs complex transcatheter aortic valve replacement, that is TAVR, and transcatheter mitral valve repair. He has been instrumental in establishing cardiac catheterization laboratory of Apollo Hospital, Bilaspur, and Medical College, Raipur. Actually, he has started the era of interventional cardiology in the state of Chhattisgarh. He has to his credit numerous awards and accomplishments. He offers free video consultation to the border security forces and their families, which is a very remarkable gesture. He is a proficient academician with 21 publications in various national and international journals and innumerable deliberations across borders. He has pioneered Hriday Suraksha Abhiyan and has developed the Heart app and the app for INR. Once again, a very warm welcome to Dr. Rajiv Rathi sir on this Foxy platform. And we are going to have a very enriching Gyan Pravah on lipids, which is very, very less talked about. And it is how important it is will come to know by our coming series of questions put to him. So as we all know, maintaining healthy lipid level is crucial for preventing heart diseases and strokes. High level of lipids can lead to buildup of fatty deposit in arteries, increasing the risk of heart problems. To know more about it and to throw light on this less discussed topic, we have with us Dr. Rajiv Rathi, interventional cardiologist from Max Super Speciality Hospital, Saket, New Delhi. So welcome, sir, on this
Thank you. Thank you
platform.
very much, Dr. Sinas. Thank you very much for such a nice introduction.
Thank you so much, sir. So we start with the very basic question, that is, are lipids important for human body and can we live without lipids?
Again, always we blame lipids for their bad deeds, and many people think that whether it is important to have lipids in their body or not. So God has created everything in balance, and it is how we utilize those things in our day-to-day practice. It is going to reflect in our daily routine. And just imagine a condition, if you don't have lipids, what is going to happen? If you don't have cholesterol, what is going to happen? So each and every cell requires cholesterol. Cell membranes are made up of cholesterol, and because of the cholesterol and the membrane which are made up of cholesterol, these cells are able to mold themselves, and they will become like they have got a fluidity type of characteristic. They can bend themselves, they can move around. So cholesterol is very, very important. If you don't have cholesterol, synthesis of various hormones are not possible. If you don't have cholesterol, absorption of so many vitamins are not possible. So you cannot imagine a life without cholesterol. So cholesterol is essential as far as our life is concerned.
So nicely, sir, you have explained that thing, because we're not understanding that there could not be any life without cholesterol, and even it is important for the absorption of hormones and many vitamins also. So, sir, there is a very misconception that cholesterol, triglycerides, lipoproteins all are same. Is it same, or they're three different things?
These are different things. So we have to understand how the thing goes. When we eat fat, what happens? It gets mixed with the saliva. There is a lipase. It breaks the fat. Then it reaches to the stomach. Again, there is gastric lipase. There is a breakdown of the fat. Then it goes to the duodenum. And from there is a release of pancreatic juices, which breaks the total fat, makes it in smaller components, monoglycerides, phospholipids, and cholesterol. And then they get absorbed. And once they absorbed inside the enterocyte, there is a formation of triglyceride.
Okay.
And you have got LDL, that is low density lipoprotein. You have got HDL, that is a high density lipoprotein. And you have got VLDL, which is known as very low density lipoprotein. And you have got IDL, that is also known as intermediate density lipoprotein. And you have got chylomicron and you have got triglycerides. So these are different components. They have got a different action and they have got a different utility. So as we go along, probably we'll be able to touch upon
So
few
it
things.
means that fat breaks into cholesterol as well as into triglycerides.
No, triglyceride is formed inside the cell, enterocyte.
Acha.
So
But
fat gets into the free fatty acid, cholesterol, and monoglycerides.
So these are all from fats only, no? What you take, you
Yes,
just
absolutely,
that I
absolutely.
wanted to know. Yes,
These are from fat.
yes. So, what is the main cause of lipid deficiency? Why do we have lipid deficiency?
No,
Is
there
it
is
due to eating less fat or no?
no. If someone is having malabsorption syndrome, then you are going to have deficiency of lipid, and there is a Niemann-Pick receptors which are present in the enterocytes. If there is a deficiency of those receptors, the cholesterol absorption will not be possible, and you can have a deficiency of lipids. So deficiency of lipid is not a very common thing. It's a uncommon thing. You have got some congenital defect, Gaucher disease, lipid storage disease. So that is not a big concern, but lipids are essential. And if you have got deficiency of lipids, then it will lead to a different type of problem.
So, how much lipids should be consumed daily? Is there any?
Yeah, how much fat one should take. So
Yeah,
because from
limit
fat
of
is going
taking
to
fat.
derive
Yeah.
all the cholesterol and other. Roughly around 20 to 30% calorie requirement should come from the lipids, fats. So that is a normal rough idea. And you can have a different type of in lipids also we should remember a few things. You have got saturated fat, you have got monosaturated fat, and you have got a polyunsaturated fat. So there should be a good combination of these fats. That is important. And second thing, we should be refrain from the trans fatty acid. That is what is the most dangerous thing. So any vegetable oil which is going to become solid in winter, that is something we should be away from. We should not use that type of oil because that has got a lot of trans fat, and any processed food which someone is going to have, that is going to have a trans fat, because trans fat gives a very good taste. So maximum processed food industry, they make they put trans fat in their preparation, so it is more palatable.
Sir, then coconut oil, it condenses in winters.
Yeah.
So,
So there are different theories, and if you see the incidence of coronary artery disease is pretty high in the Kerala also.
yes.
So there is one school of thought that coconut oil is good even for heart, but as present we feel that anything which get condensed in the winter is not good for the heart.
This is very good insight because there is a confusion because south when we go south they say you should eat everything in made of coconut oil, which we couldn't I mean accept. So I wanted this from you people only
No,
that you can
no,
suggest.
no.
But you said here
Anything.
there is two
Yeah,
school of thought. So
yeah, there are.
but we should avoid, I think.
Yeah, we should avoid it.
Yeah. So, which vitamin deficiency affects lipid absorption? Is there any vitamins required for lipid absorption or
No,
no?
it is on the contrary. If you have deficiency, if you are not taking lipids properly, then there will be a deficiency of vitamin A, vitamin
It's
D,
the
vitamin.
other
So,
way around it is.
yeah,
Or is there any hormone to control lipid absorption, which is same?
same.
If lipid, there will be lipid, then
Yeah, yeah, lipids are important.
lipids are important, not the hormone vitamin.
No.
Because for getting a good ratio of lipids and hormones and vitamins in your body, you
You
need to
should
have
have.
some, yeah, at least 20 to 30%.
Yeah, so it is calorie requirement, 20 to 30% calorie requirement should come from fat.
Yes, even diabetics, we say that this portion should be carbohydrate, this much protein, but there has to be at least 20% fat.
Yes, yes.
There is a general belief that lipids are the causative factor for heart attack. Is it correct, sir?
Yeah. If you have got something in excess, then it is going to create problem. And as I mentioned earlier, it is low density lipoprotein, which is very, very important. And this is a causative factor for coronary artery disease, for brain stroke, and for peripheral vascular disease. And one should have a proper level of LDL. And if someone is having different type of risk factors, then again one has to be very careful. So LDL level is important as far as causation of coronary artery disease or heart disease is concerned.
LDLs will be within limits.
Yeah, so there are different categories, different, it depends whether someone is having heart problem or not. If someone has got diabetes, hypertension, family history. So on the basis of all these things, we decide how much LDL level is acceptable in that particular patient. And particularly Asian patients, particularly South Asian patients, they are more prone for heart diseases. We have got incidence 2 times to 3 times from the Western population, so we have to be more careful as far as our lipids are concerned.
Do you have narrow arteries comparative to our Western friends?
Yeah,
Narrowing of artery, a little. Yeah.
our
Because-
artery is relatively smaller than the Western people.
Yeah. So, is there anything like good cholesterol or bad cholesterol?
So LDL, since it causes the heart problem, we say it's a bad cholesterol. He's a bad guy. And HDL, which removes the cholesterol from the periphery and brings to the circulation. And so that is known as a good cholesterol, that is high density lipoprotein.
Okay, sir. Thank you. How important is regular screening of lipids? Should we start getting our lipids screened from which age?
So ideally, recommendation is between 11 to 19 years of age, one should have at least one screening of lipid profile.
Even at that
11,
age?
11 to 19, yes, in between that. That is
Yes, we are not knowing.
so 11 to 19, one screening is very, very essential. And if someone has got a familial history of hypercholesterolemia or heart disease, in those subset of patients, where if someone has got a very strong family history, and then as early as 2 years, at the age of 2 years, we should have one lipid profile.
सर उस समय भी पता चल जाएगा कि हाई है कि
बिल्कुल. So at least we can start our preventive strategy right from that age, because that's a very, very high risk patient. Suppose someone has got a history that in their family at the age of 25, 30, 40, there is an incidence of acute heart attack. So that becomes a very, very high risk category. And someone has got a hypercholesterolemia, familial hypercholesterolemia. So again, that's a genetic disorder. So we have to screen right from the age of 2.
Wonderful, sir. So from 10 to 19 years, 11 to 19 years, once to know the, and if there is
and
a
after
family
say, then at the age of 30, 35, and if lipids are normal, then every 5 years or 6 years, one can have a lipid profile. And after the age of 40, if someone has got an acute heart problem, or so they can have a more frequent measurement of their lipid, because we have to control the lipid to a desired level. So, but
अभी तो सर
primary prevention early. Yeah, please.
जनरल पॉपुलेशन क्या है सर? After heart attack they come to know is there is something like lipids. They don't even know.
So that's a problem.
Yeah. So this awareness is very, very important. We'll come to the later questions, because I've made some question like that, so that how can you make them aware? So coming to another question, does high cholesterol give any warning symptom?
Unfortunately, no. And if someone has got a hypercholesterolemia, there is no warning symptom, and first warning symptom can be heart attack
or
or
stroke.
peripheral vascular disease or brain stroke. So you have to search for it.
Okay. Is it possible, sir, a person is having everything normal, even the lipids are normal, cholesterol normal, HDL good, but then also can he or she have stroke?
Patient can have, but in those
That can
subset
be.
of patient, subset of patient, we have to look for other thing also. There is
Acha.
something called lipoprotein A or little a. So majority of times, if LDL is normal, cholesterol level is normal, and patient is having stroke or heart attack, and we measure the LPA, the LPA level is high. LPA is again a type of protein which is very thrombogenic. So it creates problem. Or you can have ApoB lipoprotein. Again, this is one of another measurement of lipoprotein, ApoB lipoprotein. So if ApoB protein is high, so these patients are also at a very high risk for
So this
cardiac.
ApoB protein, we can get it
Yes,
done.
commercially available in all
Acha.
the labs. They are being done. Both the literal LPA and
LPA, ApoB
apoprotein B.
protein. This is a good insight. We're not at all knowing about this. So, how to hit high triglycerides and cholesterol? How
High
to
triglyceride, it's a different thing, and no causative. It has been also known as a causative agent as far as heart disease is concerned. Earlier, we were thinking that it is not a very important risk factor for heart problem, but now it is being considered. And if level is more than 150 in spite of the statins, then we have got drugs and isoco ethyl pentanil. So this is one drug which is being given in the dose of 1 gram twice a day, and it lowers the triglyceride level. But it should be used once your patient is on a statin and level is not controlled.
it adds
Triglyceride
to
is more
the.
important for pancreatitis, because if level is high, then these patients are going to have pancreatitis.
I have seen, sir, obese patients having pancreatitis. I remember one of my colleagues was very obese and he suffered from pancreatitis, acute pancreatitis, and he couldn't survive also.
So
This is one case I remember.
triglyceride level is very high, then these patients have to,
Maybe.
but their triglyceride will be in the range of 1000, 1500, 2000. And these
Maybe.
patients are at a risk of pancreatitis.
Yes, sir. Is there any way to increase this HDL, the heart protective HDL?
So it is diet and exercise. And earlier, few drugs were tried, but those have not resulted in any beneficial effect. So all the researchers, they have been stopped. And genetically, if you see the South Asian patients, they are at a they genetically they have got a low HDL level. So right now we don't have a drug to improve the HDL level. Diet and exercise are the only thing, and whatever drugs we had were not of any benefit as far as improvement in the lipid profile status is concerned.
तो डाइट में क्या होगा सर?
Diet में nuts,
Yes.
fresh vegetables, fruits, and you don't have much.
Sir, is there anything like quantity of nuts कितना होना चाहिए? Like somebody
Nuts.
said at least it should come in the fist.
Yeah, usually the thumb rule is whatever you can have in your fist, you can consume without any problem.
So I think this is important for the viewers. Kindly note it. Why men are more prone to heart attacks, sir, in comparison to the female counterpart? Same age, but male will have, females are
No,
protected.
females, they have got a protective benefit because of the estrogen hormone. And before the menopause, after menopause, male and females, they have got a equal incidence of myocardial infarction or coronary artery disease. So, and if females, they have got diabetes, against the incidence is almost same. And if females are smoking, the incidence are same. The more important thing is if females they develop coronary artery disease, their prognosis is relatively poorer than their male counterpart.
Okay. Obesity is a causative factor in promoting heart attacks. Is it true? Obesity? If you see an obese patient, can we say he's likely going to have a heart attack?
I will not say obese patient, but why there is a obesity that will determine whether the individual is going to have a problem or not. If physical inactivity is there and metabolic syndrome means that lifestyle is not good, patient is diabetic, then he is prone for heart disease. But per se, obesity alone is not a causative factor, provided someone is doing a regular physical activity. Physical inactivity, obesity is detrimental.
Okay, sir. So this concept is wrong that a obese person is likely going to have heart attack. Should not think like that.
No,
if
but
he's under control.
Yeah,
No, he's
but
doing
if
exercise and taking good diet and doing his screening also for the lipids regularly. Yes, sir. Sir, there is also a misconception that when you have started, you are on a medication like statins, it can never be stopped. Or is there any chance that if your cholesterol or lipids level comes normal, you can leave statins?
See, it is something like diabetes and hypertension. As long as you're taking the medicine, your blood pressure is controlled. As long as you're taking the medicine, your diabetes is controlled. As long as you're taking the medicine, your cholesterol is controlled. The moment you are going to stop the drug, again the cholesterol level will go up. So it's a lifelong therapy. You just cannot stop it.
Our yoga instructor, they say that if you do regular exercise, practice yoga every day, you're likely to leave, you'll have chances to leave your medicine. ऐसा तो नहीं होना चाहिए सर. आप स्टार्ट किए हो तो डोज कम हो सकते हैं.
हाँ, डोज कम हो सकता है, चीजें कम हो सकती हैं. See, if suppose someone has got a heart attack, in those subset of patient, we would like that LDL should be less than 55 milligram percent.
अच्छा, okay.
So we have to come down to less than 55 milligram percent. So by yoga and other physical activity, it is quite possible that you might be requiring only 20 milligram of rosuvastatin or 40 milligram of atorvastatin. It is quite possible. Or even at times you can have 10 or 20 milligram of statin. But you have to be on a statin.
Yeah.
You cannot avoid
you cannot leave it.
You cannot avoid it.
Okay, sir. Sir, there is another misconception that statins are responsible for calcification of arteries, responsible for arterial plaque formation, and also it causes diabetes.
As far as diabetes is concerned, yes, there is an association. If those who are pre-diabetic or those who are supposed to have diabetes in future, their diabetes can be unmasked by the statin. This is a true thing. It is not a misconception. It's perfect. As far as calcification is concerned, when the plaque gets stabilized, there can be calcium formation. So per se, statin is not going to cause the calcification.
Yes.
There is a stabilization of plaque and there can be some calcification.
Calcification formation हो सकता है. Okay. So to some extent it is
No, no, it is not. It will not cause calcification.
No, it's not cause, but after plaque formation, because when it resolves, there is calcification.
No, 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 no.
No,
No,
acha,
no,
acha.
it is not like that. There is a plaque formation, and as you grow older, there will be calcification. So if plaque is becoming older and older, there will be calcification. If someone has got a heart attack at the age of 25, you will not find any calcium there. But if someone has got a coronary artery disease at the age of 70 or 80, you will have a lot of calcium. So statin per se will not cause calcification. It will stabilize the plaque, and stabilization of plaque will become harder, and then it can become a calcified plaque.
Yeah. Sir, when you all do angiography or angioplasty, those arteries which is calcified, you must be finding it very difficult to do.
Yeah. So we have got a lot of things to deal with it, and if artery is quite calcified, we are able to pass on the only wire and we cannot pass the balloon. In those subset of patients, we do a drilling of those artery with the help of rotablation or orbital atherectomy. And if we are able to pass the balloon, though in those cases we can do the cutting balloon and we can break the calcium, or we have got balloons which emits the ultrasound waves and they crack the calcium, that is known as intravascular lithotripsy. So we have got modalities to deal with.
I was
And
going through your CV and I read it, so I wanted to ask it also.
very interesting thing, we have got a few catheters by which we can do a imaging inside the artery. Intravascular ultrasound we can do. So we know how much calcium is there, whether that is in 360 arc or arc is not complete, how much thick the calcium is. We have got optical coherence tomography. So by these methods, we are able to assess the thing and we can do the procedures.
Sir, your take on sensitizing now public awareness. How will you make our public aware? Because they don't even know. They understand everything is safe. So regarding lipids,
So
कैसे
most
करेंगे अभी?
important
How?
thing is we should have a good lifestyle. That is the most important thing. A regular physical activity, at least minimum 30 to 40 minutes walk, at least 5 times in a week, and in those 30 to 40 minutes, you should be able to cover around 3 to 4 kilometers of distance. So that should be the pace, and that should be the regular activity, number one. Number two, diet. Diet is very important. We should have a lot of fresh vegetables, fresh fruits, nuts, and we should not have too much deep fried things. And these are very, very important things. And second thing which I started thinking is, if someone is having cholesterol problem, is a dyslipidemic, when they are not able to digest their own cholesterol, they are not able to cope up with their own cholesterol. If they are going to have cholesterol from exogenous source, so how difficult for the body will be.
Correct. Yes, it's.
So we should be careful as far as our diet is concerned.
Sir, I think in the schools also this awareness should be made right from the beginning. Our children also
I,
should.
I have formed one program, and that was Bal Shakti, and I targeted students of class 6, 7, because not 8, because that again they have to read a lot of things. So if we teach them how to take the blood pressure,
Hmm.
and we should empower them that they should take the blood pressure of their parents, and what is the problem with the blood pressure, and how we can control our blood pressure, and why the diet is important in controlling the blood pressure. If we start from that age, so if they are going to learn all these things at the age of 10, 12 years, when they grew up, they'll be knowing all these things and they'll be much aware as far as lifestyle diseases are concerned. And at the same time, they will be able to take care of their families, parents, and they will make them aware that you should have a healthy lifestyle. And वो एक कहते हैं ना, जब बच्चों को चौकीदार बना दे तो फिर पेरेंट्स के लिए it will be very difficult to move around.
न अपने खाएंगे न उन्हें खिलाएंगे. सर, आपका ये मैंने आपके देखा हृदय सुरक्षा अभियान, ये क्या अभियान है सर? यही वाला
नहीं, हृदय सुरक्षा अभियान that was initiated in Central Coalfield and with the aim that the moment someone gets this heart attack, so we should be able to diagnose them early. Patients should be able to diagnose their symptom early. They should reach hospital early, and in hospital also we should be able to diagnose that problem early and treat early. So if you treat heart attack early, the chances of permanent damage to the muscles are likely to be less. So that's how you are going to save the muscles. And once muscles are saved, the pump is saved.
तो सर वो हार्ट ऐप क्या है और INR ऐप, ये what is this?
INR, see, you must be aware that patients who have got mechanical valves, mechanical heart valves,
Stenosis and all.
yeah. So there is a valve replacement for various type of valvular heart disease, and once you place the mechanical valve, these valves are thrombogenic, and to avoid the thrombus formation on valve, these patients should be on vitamin K antagonist drugs, that is warfarin and acetron. And these drugs, they have got a very narrow therapeutic range, and that range has to be decided by INR, that is International Normalizing Ratio. So by INR, we come to know whether we have to increase the dose of acetron or warfarin, or we have to decrease the dose of acetron or warfarin. The biggest problem is, suppose we have done the valve replacement in Delhi. Patient is from, say, any village from suppose from Gumla, near Ranchi. And so how the patient is going to maintain his or her INR? It will be difficult for patient.
Every time getting
normal doctors who are not taking care of the valvular patients, they will not be able to adjust the doses of acetron or warfarin. Patient will be able to get his INR test done in any of the lab, but who is going to take care of adjustment of the doses? So with the help of this app, we are able to empower the patient to manage the doses of INR, to manage the doses of drugs to maintain the INR. So what he has to do, he has to just put the doses what he or she has been taking, put the dose of those drugs, mention the INR which is presently there, and the app will calculate the dose for future.
Very nice. So simple for them.
It's very simple. People are using it.
This I wanted to know because I'm really curious. What is this?
It's a very good app.
Yeah, very good app. So now coming to the rapid fire questions, we are coming to the end of our podcast. So one major, sorry, this will be quick answers. One major concern for the cholesterol.
One major concern. It is a LDL, which is a causative agent for heart problems.
Yes. So you have to get checked our LDL.
Yes.
The most underrated habit for heart healthy life.
physical activity.
Yeah. HDL versus LDL. What to target first?
LDL.
Correct. One food that is misunderstood.
Eggs.
Sahi, sir. What is more dangerous, low LDL or high, low HDL or high LDL?
High LDL.
Thank you, sir. One message for our viewers.
Healthy lifestyle is a backbone as far as prevention of heart diseases are concerned. One has to adopt a healthy lifestyle, good physical activity, good diet. And one more important thing as far as doctors are concerned, we should know how to get rid of our stress. And stress is a very, very important causative known factor for heart diseases nowadays. So we should know how to get rid of our stress.
Thank you so much, sir. I hope our viewers are now updated regarding lipids, which is very less talked about, especially in our gynecology platform. We don't discuss much about this. But sir, regarding INR, I'm very, very particular of doing INR whenever I take a cesarean cases. Whatever I get the reports, platelet and everything, but I'm not satisfied. I do like to get an INR also.
Because
So
if
thrombin time in INR is must.
so INR, because many patients has got a liver problem and they are not aware of those things. So by INR, at least you come to know that this patient is at a high risk or not.
Yeah, it prevents from PPH also.
बिल्कुल.
When you know from before, कितना blood arrange करके रखना है नहीं. So thank you so much, sir, for
Thank
being
you.
with us.
Thanks a lot. Thank you, Lord.
Thank
Thank
you
you.
so much.
Thank you.